We are IRYA. Who we are. The Immigrant and Refugee Youth Action Project is a participatory action research project about the experiences of immigrant and refugee youth and families during COVID-19. Our group is made of individuals from 14 to 45 years old who identify as immigrants or refugees and or work at Flamboyant, Global Action Project, South Bronx United, Terra Firma, and the CUNY School of Professional Studies Youth Studies program. What we did. We surveyed over 60 people, ages 14 to 65, and conducted 4 focus groups, 2 with residents in Queens and 2 with residents in the Bronx, as these were the areas most affected by COVID during our project. We had one of the focus groups in each borough that had participants ages 14 to 24. The other focus group consisted of participants ages 25 and up. Here's what we found. Health. 15% of people say they have little to no access to medical care of any kind during COVID-19. 80% of respondents were unable to get tested for COVID-19, yet 21% reported symptoms. 28.5% of people said that their immigration status prevented them from getting tested for COVID-19. Speaking from experience, mental health is a ticking time bomb. What I felt when COVID-19 started was fear. Fear of getting infected, fear of going out, because the illness is still outside. I felt in the night that death walked the streets. Food. 68% of ages 13 to 19 said access to food has become more difficult since the start of COVID-19. Speaking from experience, translated from Spanish. She told me, "It seems like God sent you, because I have not eaten in a week," and that broke my heart. Education. Almost 1/3 of the youth ages 13 to 19 in our study lacked internet access at home. The other third in our youth study reported being not comfortable or very uncomfortable with online learning. Speaking from experience. Translated from Spanish. I have a son who is in kindergarten, who is just learning to read and write, and English makes it very difficult for me to help him. I'm very stressed with the homework assigned to him, and sometimes I am very tired. Employment. My father temporarily stopped working due to COVID-19. I'm the only one that is currently working. Working remotely has made it possible for my family and I to pay for food and housing. I had to file for unemployment for them, my parents, because my mom is out of work. There was no translations of anything, and I had no idea. I don't know. I'm not unemployed. I never had to file for unemployment, nor did I even know that was a thing. It's good that it's a thing, but yeah, when I had to do that, it was really scary. Like all these questions, I had no idea how to even answer. Housing. 33.3% of people are very concerned about paying for housing. 29.8% are somewhat concerned for paying for housing. Therefore, 63.1% of people are concerned about paying for housing. Yet people are finding ways to step in and help each other when they feel like they aren't able to access government support to maintain them and their families until they can get back to work. Communities sometimes, with the support of local CBOs, are forming mutual aid networks to keep families afloat. Speaking from experience, translated from Spanish. We are receiving delivery, and this is how we're getting food, so that no one goes hungry. In our house, we also ask our neighbors if they have enough food. Another world is possible if we listen. Are you listening? Dear Mayor, We want you to suspend rent. Housing is a major concern for undocumented families who are not eligible for benefits such as unemployment, subsidized housing, SNAP, and health benefits. Mayor, it's difficult because people that pay their taxes who are immigrants in times like this, they aren't getting anything in return. They're giving help only to people who have papers. It is as much their country as it is yours because they helped build this and they help the community by doing the jobs that are the hardest and that other people don't want to do. So I say we should pay attention to the minority community as well. Thank you for your time. Mayor, spend money on schooling and public health instead of policing and incarceration. We need you to make everyone feel safe in the city. Our group has a few key recommendations that have emerged from our research. Make sure everyone who needs food has it. Suspend rent for low-income families regardless of immigration status. Provide timely and comprehensive information about resources in multiple languages. Provide more academic and social support when it comes to online learning. All youth should have a learning device, example, a computer or laptop, and high-speed internet access. Provide frequent communication about the importance of testing and costing information. Include communication methods that immigrant communities use often, bilingual news, radio stations, posters, etc. Provide rapid COVID-19 tests for all, especially those with underlying health issues. Offer mental health support to cope with loss, fear, and uncertainty. Include undocumented and mixed status families in future relief packages. Develop more remote work opportunities that are accessible to immigrants and refugees, regardless of status, and more worker-owned cooperatives with remote work. Support more local mutual aid networks. IRYA would like New York City changemakers to consider a few more questions. How do we implement strategies that build upon local connections in immigrant and refugee communities? How do we resource immigrant and refugee communities so that they are cohesive and resilient? How can we become more comfortable with being challenged and engaging with diverse opinions? Are you listening?